So speaking of that, Mike Knight, internal sales rep here at People's Health, joins us. I think, Mike, you and I have done this once before.
We did last year.
And it was great, and I know a lot of folks appreciate it. So welcome to the show.
Thank you. Good afternoon. Thank you for having us coming to the Medicare Center today.
So, I get an opportunity to talk to a lot of folks that have visited here. They really appreciate it. Always a lot of gold stars on behalf of your staff. I love your staff because every time I walk in here, every single one of them, before I even walk in, I kind of look. They all have a smile on their face.
It's nice. Yeah, it's great to come to work here.
Yeah. So it's good. So tell us about what's going on today.
All right. So basically, we're here to answer questions. We're just starting off with the annual enrollment period. So this is a great time, as you said, to come in, get information, ask questions. We've had people coming in since Saturday when it actually began, and it's a non-intimidating place. You can come get, as you said, something from Joe's Nose Food to just in coffee, and just sit down and talk to somebody and get some information that they may benefit them in their decisions.
So, I've referred to People's Health as a forward-leaning organization, and I really believe that because having seen what goes on here live up front and real, before we end up talking about Medicare, give us a little backdrop about People's Health.
All right. So People's Health is a Medicare Advantage organization. We were founded in 1994 and have spent more than 20 years providing high-quality, cost-effective care services to people with Medicare. And now we serve more than 92,000 plan members around the state. Our plans are built on providing easy access to care and face-to-face personal attention. That's why our members are backed by the Medicare Health Team, made up of the healthcare professionals who assist and help coordinate care. From simple reminders about annual screenings to complex care coordination, we work with our members to help them get the best health possible.
So when we think about Medicare Advantage, I've heard the term original Medicare. It's not something that you really need to be scared about. You just got to kind of absorb it, take it in, right?
Understand it, yeah.
So what does that include?
So original Medicare includes Medicare Part A and Part B. It covers the inpatient care you would receive at a hospital. Part A is the part that you receive at the hospital, a skilled nursing facility, or a hospice care facility. Part B covers outpatient services, so doctors, diagnostics, blood work, x-rays, preventative care, outpatient surgery, vaccinations, health screenings. Original Medicare does not include Part D, so you must enroll in a standalone drug plan to receive drug coverage. If you don't sign up for credible drug coverage when you're first eligible for Medicare, you may have to pay a monthly Part D late enrollment penalty for as long as you have Medicare. Credible coverage means that's as good as Medicare.
So there are timelines that we just talked about, with this being one, and I think there's others with Part A, Part B as well, and there's punitive measures that the federal government's imposed, or the state, if you don't meet those timelines, right?
Correct. If you don't have some kind of a retirement coverage, some kind of employment coverage, and you're on Medicare, they will impose penalties if you wait too long to sign up for Medicare. So you definitely want to be aware of those and take action prior to incurring those penalties.
So you want to be on your game.
You definitely want to be on your game.
Right? And
right.
And the coaches are here. Here at 3017
right.
Veterans.
The team is here to help.
Absolutely. So what are your costs under Medicare?
So if you or your spouse paid Medicare taxes while you were working, you won't have to pay a monthly premium for Part A. However, most people pay a monthly Part B premium. And premiums are based on income, and they may change from year to year. For 2023, the Medicare Part B premium will be $164.90. Most people with original Medicare also pay an annual deductible. This means you must pay a certain amount of money out of pocket each year before Medicare will begin paying towards your health care. Other costs under original Medicare, your copayment and coinsurance amounts. These are your out-of-pocket costs for covered services. Copayments are fixed dollars amounts, for example, like $10. For coinsurance is a percentage of the total cost of the service.
So as an example, I think if you pay a 20% coinsurance for most covered services under the original Medicare, that means if a service costs $100, you pay $20.
You pay $20, correct.
And Medicare would pay the remaining $80, which runs a lot like conventional health insurance.
Right. That's what these are modeled after.
So that's original Medicare, and now there's also what we hear a lot about Medicare Advantage.
Mm-hmm, sure.
So what makes up Medicare Advantage?
All right, so Medicare Advantage plans are another option for getting your Medicare Part A and Part B. These plans are offered by private companies like People's Health. We are paid by Medicare to provide health care coverage to people with Medicare. They must follow rules set by Medicare and must cover all the services that original Medicare covers. But most Medicare Advantage plans provide additional benefits that are not covered under original Medicare, like fitness center memberships, transportation, coverage for routine services, dental, vision, and hearing.
And so these services are not cookie cutter. They're kind of customized by you folks. Then,
Correct, right? Each plan can design them the way that they want to.
And you guys kind of serve as the fiduciary for Medicare as it relates to these Medicare Advantage plans.
That's right.
And so that's why it's important. I say all the time, shine a light on this decision.
Mm-hmm.
I mean, there are some things for you to consider. It's not always just a cookie-cutter model.
Yeah, I mean, there should never be any surprises. If there's a question you have about your health insurance, you should be able to get that question answered before you sign up for something. It should be clear. You should be able to see it in writing. You should be able to get a firm answer on a question about a benefit that you have.
And I've talked about making this learned decision, and we talked earlier about, I made a statement that the federal government's going to change the rules. So these things are subject to change, and so you really need to stay on your game.
Yeah, we do follow benefits year to year, and some of the rules and regulations for coverages, they do change. So it is good to check in this time of the year every year and see what the benefits are going to be for next year, look at the plan you're on, see if that's going to serve your needs.
All right, when we come back after the break, we'll start off with costs. Is it more expensive, Medicare Advantage over original Medicare? How does this all work? Folks, we're broadcasting live because it's Medicare Enrollment Day, and we're broadcasting live right here from the People's Health Medicare Center on VETS. That's 3017 VETS, and we're talking with Mike Knight, Internal Sales Representative for People's Health. If you have a question, give us a call, 504-260-1870 on the Oakland Heart Jewelers Talk and Text line. We really want to hear from you. We really want to resolve any questions that you may have. So take advantage of this right now. We'll be right back. This is Newell on WWL. Welcome back, folks. We're broadcasting live for the Medicare Enrollment Day here at People's Health Medicare Center on VETS near Causeway. Medicare Enrollment opened this past Saturday, October 15th, and it goes through December the 7th. So if you have questions, a team of experts are here right now with answers. Stop by. We'd love to see you. This is Newell on WWL, and we're visiting with Mike Knight, the internal sales rep for People's Health. Mike, on the text line, once you are enrolled in Medicare already, do you have to enroll again?
No. With your Medicare Advantage plans and regular Medicare, once you're enrolled, you'll be staying on that. As long as you pay that Medicare Part B premium, you'll stay on Medicare. And if you're with a plan from People's Health, if you're happy with it, it will keep renewing for the next year. All
right. Let's go to Rick. Rick, you're on with Mike Knight.
Hey, gentlemen, thank you. I'm going to be real quick, and again, thank you. There's a few people like myself want to know the answer to this question. With Social Security disability, you are issued a Medicare card with Part A only. Now, you do not get Part B, and it's not taking out your Social Security disability check monthly. So with that Part A only, do you get any People's Health or any of the Medicare benefits from any of the People's Health or its similar competitors?
So you would need to have Medicare A and B. That's a requirement from Medicare. So if you only have Medicare Part A right now, you would not be eligible for any Medicare Advantage plans. You could pick up Part B, and then you would become eligible.
That's my question, Medicare Advantage. So you can't get any of it with Part A only, being on Social Security disability.
That's correct. You need both A and B.
Thank you, Rick. Appreciate the call. So, Mike, is Medicare Advantage more expensive than original Medicare?
So every Medicare Advantage plan comes with different costs. Your overall costs with Medicare Advantage are often lower than costs under original Medicare. because Medicare Advantage plans are required to limit your yearly out-of-pocket costs, while original Medicare places no limit on yearly expenses.
Oh, so there's potential savings there then for sure.
Oh, definitely, yeah. And then you get extra benefits as well.
What are the other costs with the Medicare Advantage plan?
So other costs, so Medicare Advantage plans have different costs. Some plans have a monthly premium that you're required to pay in addition to your Part B premium, but people's health plans have a zero plan premium.
For all of the Medicare Advantage, for all of them?
For all of ours, correct.
Oh, okay. So when someone joins a Medicare Advantage plan, they still have Medicare?
Yeah, if you join a Medicare Advantage plan, you still have Medicare and all the same rights and protections that come with it. However, you get most of your coverage from the Medicare Advantage plan, not from original Medicare.
So that would be both the Part A and the Part B.
That's correct.
And then if you want Part D, you purchase that in addition.
Correct. If you're on Medicare alone, then you'd have to purchase the Part D.
Right. So how do you figure out, and I know that's the benefit of this, of the People's Health Medicare Center, right? Is,
big advantage.
You know, how do you choose what's right for you? I keep saying you want to make a learned decision. You need it to align with your health care needs, right?
Right. So you want to consider a few things. Cost, what services and prescription drugs do you use most? Also, what kind of coverage do you need? When you look at a Medicare Advantage plan, see if your doctors are in network, and then ask if you could use those additional benefits. Remember, routine services such as dental, vision, and hearing are not covered under original Medicare.
Now, you guys have a very broad network, right?
We do, yeah.
And I've heard that from a lot of participants, that people are really impressed with how broad the network is.
Yeah, we have a large network of doctors, but we always still want to check and make sure that they are in our network.
Because that changes too?
It does not.
It's
not wholesale changes,
right.
But you'll still have a few come and go, and you want to just verify that they're on the plan.
So specifically, let's hone in and talk about People's Health. What kind of plans do y'all offer?
So most of our plans are HMO POS plans, which means Health Maintenance Organization with a point of service option. Generally, members in our plans must use in-network providers to receive coverage, except for certain services such as emergency and out-of-area dialysis. For 2023, there's a new point-of-service benefit option that allows members to see out-of-network dental providers, though these services may have higher cost.
And this runs just like traditional insurance plans.
Correct.
You have in-network, out-of-network.
Exactly. Right.
So what other plan types do y'all have?
We offer two point-of-service plans. We also offer PPO, Preferred Provider Organization plans. And then we have some dual-eligible special needs plans, and that's for people that have both Medicare and Medicaid, and they generally have lower costs and additional benefits.
So you want to be able to sit down and talk about the differences between HMO and PPO to make sure it aligns with your health care needs.
Correct. You want to make sure that it's going to be serving the needs of your health care. I mean, your health care is important, so you want to make sure what you're getting is going to provide what you need.
Yeah. And, it's the ease of administration, the institutional knowledge that you have with both facilities and doctors. So you want to try and get the one that most closely align, especially when you're migrating at age 65 or otherwise to a Medicare plan.
Yeah, you want to check things that have been working for you. You want to make sure they're going to work for you in the future, and that's what we do here.
Yeah, if it works, you don't want to change it.
Right, exactly.
So who is eligible for these plans?
To enroll in any People's Health plan, you must be eligible for Medicare Part A and enrolled in Medicare Part B. There's other eligibility that vary by plan, but for Choices 65, we have 4 segments, and to enroll in these plans, you must live in the service areas. We also offer special needs plans, which I mentioned earlier. If you have both Medicare and Medicaid, Secure Complete is only available to people with full Medicaid, while Secure Health is available to people with full and partial Medicaid.
So one of the requirements is you have to be 65?
Just Medicare. Most people get Medicare when they turn 65, but like that gentleman that just called, if he would have had Medicare A and B and on disability even under 65, he would have qualified.
He would have qualified. All right. Let's go to Bill on line 2. Bill, you're on with Mike Knight.
Hey, been listening. Really, I enjoy this information. Okay, 65 years old, I got my Medicare. Okay, and now I'm 68. I'm still working full time. I'm drawing insurance from my company, so I'm covered with insurance, Blue Cross Blue Shield. I have the Medicare card. Does that saying I have Part A and Part B? Because I was not told that when I first signed up for Medicare. And
So
still working, what do I do?
Okay, so you would have to look at your Medicare card and see if it says hospital benefits only on it or if it has Medicare Part A and Part B on it. Because you're working, you can remain on that group insurance, and then once you are ready to retire, you can, if you don't have Medicare Part B, you can go get it, and then you could sign up for a People's Health Plan.
So I wouldn't face a penalty.
You will not face a penalty as long as you maintain that group insurance while you're eligible for Medicare.
Yes. Okay, great. Okay.
And
now,
how does that work? Is his insurance primary and Medicare would be secondary?
Yeah, thank you.
So the benefits align?
Somewhat. So they do coordination of benefits. So, Bill, while your group insurance is in place, that group insurance will be primary, and then your Medicare would be secondary.
Yes,
so it reduces your out-of-pocket exposure.
Somewhat, yeah.
The lady told me that if I went to the hospital, that I would present the Medicare card with my other insurance card, but she didn't mention it for anything else. So it gives me, I didn't know where to go look on the card to see if I have the Part B.
Okay,
but from my understanding, what she told me, I might only have Part A.
Yeah, from what you're telling me there, that may indicate that you only have Part A because she only referenced hospital coverage. But you can look on your card, and it'll say, if it's only Part A, it'll say hospital benefits only. You can also call Medicare and ask them if you have Part A and Part B.
Okay. And so at the time I retire, I'm no longer working. My insurance is gone. At that time, I can go ahead and sign up.
You want to start in advance. You want to kind of plan this out. Give yourself about 90 days prior to retiring and start working on getting your Medicare Part B.
Got that, Bill?
Thanks a lot.
All righty, Bill. Thank you so much. Best of luck to you. These are important decisions. So we're visiting with Mike Knight, internal sales rep for People's Health. Mike, what extra benefits are People's Health plans offering for 2023?
So we do offer some really good coverages for vision, for dental, for health club memberships. We also have over-the-counter items. So if we have health and wellness items where you can go and get cold remedies, vitamins, different products like that, diabetes care, those types of things.
So so how does that work?
So what we do is we send out a pre-filled debit card, and you can use it to shop in-store participating retailers, or you can buy items online or by phone or by mail order.
Oh, really? So it's very flexible then.
Correct.
And easy to work through that process.
Right, yeah. Then we give them multiple ways so they can access that benefit.
And so this credit amount, this has increased as well this year?
It has. Yeah, for all of our plans, for most of our plans, they've increased the amount.
Awesome. So you mentioned that People's Health has special needs plans that are a little different. The benefit package is a little different. How does that work?
Okay, so the way that works, if for the special needs plans, you'd have to have Medicare and Medicaid, and they do get the special needs plans get a monthly credit to spend on approved over-the-counter items and healthy food. Members have multiple options for purchasing food or shelf-stable pantry items and fresh groceries. Members can order pre-cooked refrigerated meals for delivery to their home.
So these are folks that may have a special needs diet and things of that nature that they have to deal with, and it requires both that Medicare, Medicaid designation.
It does require the Medicare, Medicaid to get the healthy food. The special needs is just the names of the plans that have both Medicare and Medicaid.
All right, awesome. All right, we got to get to a break. 504-260-1870 on the Oakland Heart Jewelers Talk and Text line. We're broadcasting live. It's Medicare Enrollment Day from the People's Health Medicare Center on Vets near Causeway. It's right next to Party City. It's actually 3017 Vets. We're talking with Mike Knight, internal sales rep for People's Health. He's the man in the know, so you want to call and get these answers. to your questions. We will be right back after the break. Stay with us. Welcome back, folks. We are broadcasting live for Medicare Enrollment Day at People's Health Medicare Center on Vets near Causeway. That's 3017 Vets. Medicare open enrollment kicked off this past Saturday. It extends through December 7th. If you have questions, a team of experts are here now with answers. Stop by. We'd love to meet you. We're all here, WWL and the folks from People's Health. I'm going to throw you a life preserver because I think your boss came over and said, you forgot to talk about this special plan relative to utility bills.
Yeah, thanks for bailing me out on that one. So there's so many other benefits that we offer. There is one thing I did neglect to mention. So with those special needs plans, they are going to be offering with that over-the-counter card and the health and wellness items, and the ability to pay utility bills, including electricity, internet, water, gas, sewer, sanitation, which is really going to help our members that are on those special needs plans next year.
That's a great benefit for sure. What other benefits do People's Health plans offer?
So they offer routine dental, which is not covered under original Medicare. It includes zero dental deductible, zero copay for all covered preventative and comprehensive dental services, and up to the plan-specific maximums. So the coverages include exams, cleanings, fillings, crowns, root canals, partials, even implants. You'd probably use up that benefit quick if you got an implant, but it is there for you if you want to.
Yeah, I don't know about those root canals.
My wife just had one. I know what those cost.
But what a great benefit. What about vision care? I heard that there are plans there too.
Yeah, so for routine vision, all of our plans are zero yearly routine exam plus coverage for eyewear. So plan members pay a zero copay for standard, single, bifocal, trifocal, or standard progressive lenses, and members receive a yearly allowance for the purchase of eyeglass frames and contact lenses. And then our People's Health Secure Complete members receive $500 each year, and Secure Health members receive $450 each year. And then our plan, People's Health plan members receive $200 each year.
And I know my wife is going to be happy about this. There's a hearing benefit because she said
we don't fix selective hearing, but we do have a hearing benefit with a zero copay for a yearly routine hearing exam. And then for Secure Complete, the members receive a yearly allowance of $3,600 for 2 hearing aids. The Secure Health members receive an allowance of $1,100, and then all other health plans have hearing aids that start at $175.
Well, when I sign up, I know she's going to want me to jump all over that benefit for sure. You mentioned earlier a couple times that Medicare Advantage plans, offer other benefits as well, things that we might not be aware of.
Yeah, so we do offer a gym membership. It's an all-in-one fitness membership at no extra cost to plan members. Members can use the gym in a nationwide network, which includes major fitness centers as well as boutique studios. And members aren't limited to a single fitness center. For example, if the member joins group classes at one fitness center and strength training equipment at another, they can go to both centers. And it includes access to over 20,000 live and on-demand virtual classes.
That's another huge benefit.
It's great.
Absolutely.
It gives you access anywhere.
All right, we got another call. Let's go to Ed on line 3. Ed, you're on with Mike Knight.
Hello.
Yes, go ahead, Ed.
Hello, how you doing? Thanks for taking my call. I'm interested in getting some information, some contact information. I'm currently on the plan right now, but I'm hearing some good things, and I'd like to speak with someone in reference to comparing what I have and possibly, maybe even switching over if that's possible.
Okay, so you can come by and see us at 3017 Veterans. You can call the number on the back of your insurance card, which would be member services, and you have people there that can answer questions for you now. But either one of those you're welcome to access anytime.
Or go to peopleshealth.com.
Peopleshealth.com, that's what I need. Okay.
Peopleshealth.com, it is chock full of current and relevant info. You're going to love it. And you know what I say about information. It's power. Empower oneself, right, Mike?
That's right.
So I know I've asked this question a couple of times, but as I look at the list of these benefits, what other benefits does People's Health offer?
So for 2023, our plans are going to include a personal emergency response system, also known as an emergency medical alert device, at no cost to members. And they connect members with trained emergency operators at a push of a button, 24 hours a day, 7 days a week. Some even include automatic fall detection. Our plans offer access to 24-hour nurse lines where a member can speak to a registered nurse about health-related questions and concerns. And then A benefit only covered by our special needs plans is a routine transportation. We want to make it as easy as possible for our plan members to access the care that they need.
Also, you guys are rated every year, and the ratings just came out again, right? And that's important because that's all about the quality of what y'all do, right?
Correct, yeah. With the star rating from Medicare, we are very proud to say for 2023 we'll be a 5-star plus again, and that just gives you a grade.
That's the most you can get?
That's the most you can get, 5 out of 5 stars. And so that gives you a grade. Medicare basically gives us a grade that everyone can see on the type of care we're providing and the quality that we do.
So that provides extra meaning when we talk about all of these services that y'all provide.
Absolutely, yeah. Yeah, I mean, because Medicare is saying that these benefits that are in print, you're going to get if you're with People's Health.
So I know we've gone through this long menu of services that are provided, benefits that is, but before we wrap up, are there any others?
Well, all of our plans also include a meal benefit, so members can receive 28 home-delivered meals for 14 days after being discharged from an eligible hospital stay. Most plans also offer respite care for our members that are diagnosed with dementia, including Alzheimer's. And respite care gives a member's primary caretaker just a temporary break where they can do caregiver duties. They can go to doctors themselves, and that's 12 care sessions every year.
So I know you guys are doing another in-person benefit presentation today. Y'all did one at 10. You're doing one at 1.
At 1 o'clock.
It's a great time to come by if you're right here in the neighborhood, right?
Oh, today's a great day. We have plenty of people here can help anybody out.
And y'all do this every day.
We're here every day.
I mean, every day. You don't need to call, but if you desire to, you can to make an appointment. But you can just show up. Y'all have staffed the facility. If it's convenient for those folks out there, it's convenient for y'all.
Correct. Members and non-members, 8 to 5, Monday through Friday.
And this is the time to do it. It's key because, once again, there are some punitive measures if you don't do things within the enrollment period. And this is the enrollment period from October 15th through December 7th.
December 7th. So, if you want to come by and get signed up, we'd be happy to see them.
Absolutely. Anything else, Mike? Wrap it up.
No, that's it. Thank you for coming. Thanks for having us today.
Well, thank you for joining us today and providing a long list of information and a long list of benefits to boot. We really appreciate it. That's Mike Knight, internal sales representative with People's Health. Folks, 504-260-1870 on the Oakland Heart Jewelers Talk and Text line. Talk and Text line. Talk and Text line. Talk and Text.